I love my job and I've always been in mental health because it's something that I've got a passion for, it's something that I enjoy, it's something that I can get up in the morning and know that I'm doing something good for somebody out there.
I love being a physio because basically I'm a bit kind of corny, but I do actually want to I like the feeling of trying to help people, and when I've kind of improved someone's life, that makes me feel good.
The things that I really love about my job is that it's fast-paced. I love the working with other professionals. I think that's fantastic, and I think that's something that could be really pulled into hospitals all over the UK. I think some of the frustrations really are just the fact that you're not able to sometimes get resources in place as quickly as you'd like to. That can actually cause quite a bit of a hinder on the system.
The challenge that we face in Birmingham is that historically we've often worked as individual organisations. The types of problems that people have now that go across health and social care really challenge us to find ways that we need to work together. We've got examples, unfortunately, of where that doesn't work at the moment, where people really do struggle to move between organisations, and we need to move on to solving those problems and moving forwards with that.
We know that we've got major challenges in actually making sure that people are able to access the services that they need across both health and social care, and that there are challenges in making sure that health and social care work together.
When we think about how we work with social services at a system level, the two organisations don't seem to always work together very well. As individuals, I have a very good working relationship with the social workers who do an excellent and difficult job, and I enjoy working with them. Unfortunately, we don't get to see enough of them because of the systems that are in place at the moment.
The message I would give to staff from both health and social care to try to bring us closer together is take every opportunity you can get to get face to face with each other, to know what each other look like and learn some first names, discover you've got things in common, that kind of thing. Because the environment that we now live in, with the separate funding for health and social care, meaning that we are all hoping that the other side are going to do what we should be doing but can't afford to, that is leading to bad blood, and it's leading to separation, and it's leading to a them and us culture which isn't helping anybody at all.
It's the most important thing is that we work all together, and we want to keep the patient in the community for the best use of the resources, because otherwise it will be duplicating if we do not talk to each other.
We think we can do a better job of using the resources across the NHS and social care, and also resources generally in the community with third sector organisations, voluntary and community organisations, that we can do a better job of working together on that for the greater aim of improving people's care and support in their own home.
Because I sort of sit on both sides of the fence, having a disabled child myself who's in a nursing home, I've obviously gone through the system. Gone through the system of having him at home, looking after him at home, then having to make a decision about him moving into a nursing home. And one of the biggest problems is communication and getting everything together. So having a coordinator to bring it all together so that we're not repeating ourselves all the time, we're not being asked the same questions from a personal point of view, not being asked the same questions over and over again.
I think the Better Care Fund gives us a vehicle for both local authorities and the NHS to really come together as true partners and look at co-commissioning services together, because rather than working in silos, I think it's about time we actually put our differences to one side and say, right, okay, we got to look after the service user here and the citizen, and put everything else aside and say, right, well, how are we going to actually move forward and deliver the services?
We have 4 priorities, which are really the 4 areas where we think joining health and social care services will deliver better outcomes and better experiences for the people of Birmingham, but also the most cost-effective way of working together. So those priorities are keeping people well where they live, making help easier to get, more effective care in a crisis, and supporting people to make the right decisions when they can no longer cope.
Some of the key benefits of working together in collaboration are that we begin to really share information, really share our vision, the things that we really want to achieve for people, it seems to me that we all want to achieve pretty much the same things, that we just go about it in our own different ways. And I think working together for us enables us to sit down in a room and really understand what those core principles about what we want to achieve are, and that we can work together to seriously achieve those, and get away from this silo working where we all do things very differently but always wanting to do the same kind of things in the end.
I could be flippant and say everybody is responsible for delivering Birmingham Better Care. It is a partnership. We do have 10 partners, and if even one of them doesn't deliver what we've discussed and agreed to try and deliver, then the whole system will not change. Things will improve generally, but we won't achieve the absolute maximum that we want to achieve.
We'll know when integration is working well, because the system will no longer be just individual organisations, but a seamless flow of patients and of staff and of information between different parts of one whole network.
I think Birmingham Better Care is really important in that it brings workers together, health workers together, budgets together, so that for the patient they're not worried about whether it's a health worker or a social care worker or a social budget or a health budget. They need a service or something to support them, and by bringing this together in this way we can make sure that the patient gets what they need at the time that they need it, in the way that they need it.
We're all on this journey together, and the only way we can do it is by talking to each other, being honest and transparent, and moving together jointly as a partnership, health, social care, and the people that we support.